Emeka? Yeah, you can come.
Good afternoon, doctor.
Yeah, good afternoon, Mr. Emeka. You're welcome. How have you been today?
God has been helping us.
Okay. So, what brought you to the hospital today? Can I know why you're here?
Doctor, the baby has not been kicking.
Okay. Since when? How long? Since morning. And you're bothered?
Yes, I am.
Okay, it's okay. It's about 2 p.m. Your baby hasn't kicked since morning. How many months pregnant? How many weeks? 30 weeks, okay. It's normal that at this gestation age, your baby should be kicking frequently. But most times, babies sleep for a long time that you may become worried that they are not kicking. It's not because anything is wrong, okay? It's just that they are tired. When you're tired, they are tired. And when you stress yourself, they are stressed, so they may just take a long nap. But I'd like to examine your stomach, your abdomen. I'd like to examine your abdomen, and if necessary, I'll send you for a test. So just so I can be sure that everything is fine. Is that understood?
Yes, doctor.
Okay, so let me have a look at you.
Okay, so I wait here, doctor.
Yeah, of course you can wait here. I'll just go to my office. It's okay. Excuse me. Yeah, this way. Okay, just lie down. It's okay. Okay, this way. This way. Yeah. Okay, any pains anywhere?
No, sir.
Okay, alright, thank you. Just help me expose it a bit, just a little bit. Okay, it's okay. It's okay. It's okay. I will need to listen to the baby's heart sound. Mr. Emeka.
Doctor.
Madam Mary, your ultrasound result is out, and I'd like to ask you a few questions if you don't mind. Have you had any abortion in the past?
No,
Okay. Have you had any termination of pregnancy?
not at all.
Not at all. Okay. Have you had any blood transfusion?
Yes, months back when I was sick, I needed a blood transfusion. So the doctor said my husband could donate since it was a universal donor.
So
Okay.
I donated.
Okay, you donated. Was the blood
Yes.
properly screened, or they just gave you blood because it's
Just giving blood.
Okay, what's your blood group?
I'm O positive.
What's your blood group?
A negative.
A negative. Okay. I'm so sorry. I'm so sorry to say, but
But what, doctor?
I'm so sorry. From the ultrasound result, your baby is dead. You told me. The baby is dead, and I understand how you feel, but there's a reason why the baby died. There's a reason why the baby died, and that's just what I need to inform you so that in the future you can prevent these future occurrences, because our body is seriously fighting all babies that are blood group type positives. So please, we did an ultrasound, and we also did some tests that showed that your baby died as a result of a medical condition we call erythroblastosis fetalis. And it usually happens when a mother who is blood group negative, could be A negative, O negative, B negative, or any blood group with a negative charge. That negative charge means she does not have the rhesus factor in her blood. So, and from information, you are O positive, and it means you have the rhesus protein in your blood. So because she doesn't have the rhesus factor, she sees all blood with rhesus factor as foreign bodies. So it explains why she has antibodies that will destroy all blood with the rhesus factor that gets into her system. So anytime, because of that sensitization, in the future, whenever she's pregnant with a baby that has a positive blood group, the antibodies, the immune antibodies, will cross the placenta from her blood to the baby's blood and destroy the baby's red blood cell.
Okay.
Good.
Doctor, it was because we didn't know about this before now.
I understand. I totally understand. It's okay, but for
She
now...
can still conceive, right?
Yes, of course you can conceive. For now, we will need to go for... we just need to do an evacuation. The baby is already dead. I'm so sorry about what happened. Madam. Madam.
Okay, doctor. Thank you so much for the information.
It's well. It's okay. You'll be fine.
Always keep in touch to know what next to do.
As you know, awareness is the backbone of preventive medicine. Let me ask you, do you even know your blood group? As a woman, it's important for you to know your blood group before you go for that abortion. It's important for you to know your blood group before you terminate that pregnancy. It's important for you to know your blood group before you take that transfusion. The reason is because if you are positive, there's no problem. But if you are O negative, A negative or B negative, any negative blood group, you need to be careful because your blood can easily be sensitized the moment your blood mixes with a positive person. Termination of pregnancy or an abortion, which usually has a high chance of the baby's blood mixing with your blood, or it could be during delivery of your first baby. Now, what happens if your baby is positive and you as a lady is negative? The first pregnancy you're going to have, the baby's blood may mix with your blood during delivery, especially when the baby is being secreted from the placenta. And when this happens, your body begins to produce antibodies against the rhesus factor. And these antibodies usually don't harm the first pregnancy because they are immunoglobulin M and they don't cross the placenta. But they form memory cells, and in the subsequent pregnancy, they become, the memory cells from the first exposure become immunoglobulin G, which are able to cross the placenta and attack the baby. So what do? Make sure that from the 28th week of pregnancy, you are able to take the Rhesus immunoglobulin vaccine so that your body does not produce antibodies. Also, you must take the vaccine again 72 hours after delivery, before 72 hours. If you are going for an abortion, you should be sure that you are not O negative. If you're O negative, you must take that vaccine after the abortion so that your body does not produce antibodies that will harm your future babies whenever you're pregnant with blood group positive baby. I hope after watching this video, you are going to check your blood group right away if you don't know it in the past. Don't say they told me my blood group is so and so. Go and check your blood group by yourself. It doesn't take time.